folks who are in attendance today. And so now that our recording is enabled, let's go ahead and talk about our intentions for today. So this is a training regarding the state of Colorado's American Rescue Plan Act, also known as ARPA, 9817 funding for home and community-based services. And this grantee training session is intended to cover several subjects that are important for all of the grantees who receive funding from HCPF and the compliance requirements that derive from the federal and state levels and how that may apply to your organization. And so, as you can see here from our agenda, we're going to go through a quick introduction and overview of the ARPA 9817 funds, followed by an overview of what grantee monitoring means and what that means for your organization. Number 3, talk about one of our first specialty topics of the day, which is duplication of time, effort, and benefits, followed by supplementing and not supplanting, followed by records retention, documentation storage, and like Wayne had mentioned, questions and answers at the end. So we will absolutely attempt to make time for that. The objective of our presenters is to move as smoothly and efficiently as possible through the content. And like Wayne had mentioned, if y'all can punch the questions into the Q&A part of the chat, we will absolutely address those questions at the end with time remaining. And so with this training being recorded and the slides being developed so that they can be shared with our attendees. This training will be available via video for our folks to be able to view later, and the slides will be distributed to all attendees. Next, please. Alrighty, so quick introductions on our KPMG team. So Rory Costello and Jamie Kilpatrick are the 2 leadership level individuals who are supporting this engagement. They're not here with us today because they're helping us with performing the grants monitoring activities that are associated for our work with HCPF. And so today you have myself and Laura Bulmer. We're both from the infrastructure, government, and healthcare groups. We work with several state clients, including other agencies within the state of Colorado, for the uses of federal funds and how that may pertain to organizations like yourselves. Next, please. All right, so let's get into training purpose. So like I'd mentioned, this encompasses a couple of overviews and then specific coverage on specialty topics that are important for you as the recipient of ARPA 9817 funding. So number 1, where our intention is to provide information and tools to address common issues that were identified throughout the grantee monitoring process. And number 2, we want to explain the importance of compliance with relevant rules and regulations. There's a lot of cross-cutting state and federal requirements that may impact your organization, your use of funds. We want to make sure that that information is crystal clear for all attendees. Next, please. So let's talk about ARPA 9817. Next, please. Medicaid's ARPA 9817, that is in reference to Section 9817 of the American Rescue Plan Act that was passed by Congress and signed by the President in 2021. That act, that section, provided an allocation of funding to various states, including the state of Colorado, for agencies such as the Colorado Department of Healthcare Policy and Financing, also known as HCPF, for a 10-point increase in their federal medical assistance percentage. And so that FMAP enabled the funding for their various Medicaid, home and community-based services and activities. And so their work with y'all on HCPF programming in the past, this enabled an expansion of those types of activities. And so the purpose of these funds was intended to supplement the existing state funds that were expended for Medicaid HCPF as of April 1st of 2021, and to enhance, expand, and strengthen HCPF. This quotation here that we're seeing on the bottom is a statement from the piece of legislation that stated that each state shall implement or supplement the implementation of one or more activities to enhance, expand, and strengthen home and community-based services under the state Medicaid program. Next, please. And so CMS published a series of letters for the states. First one is SMD number 21003 on May 31st of 2021 that guided the usage of these funds. So per this letter, states can implement a variety of activities that include enhancements to their services, eligibility, infrastructure, and reimbursement methodologies, ultimately, like we talked about before, to enhance, expand, and strengthen Medicaid HCPF. And so states may use the funding to address the continued impacts of the COVID-19 pandemic and engage in both short-term and long-term implementation activities to build capacity and reform long-term care services and supports, also known as LTSS. So that letter, SMD 21003, had several examples of areas for funding usage. So these included, as you can see in the chevrons below, workforce training, assistive technology and other supports for persons with disabilities, transition coordination, provider payment rate and benefit enhancements, addressing social determinants of health and health disparities, as well as employing cross-system data integration efforts, and expanding the use of technology and telehealth. Next, please. And so to maintain eligibility to use the funds under ARPA 9817, the state of Colorado must comply with the ongoing reporting requirements per the Centers for Medicaid Services. And so HCPF submitted an initial spending plan and a narrative for CMS to review and approve. Prior to June 3rd of 2023, the states were required to submit quarterly spending plans and narratives. After that date, states were required to submit a spending narrative semi-annually and then a spending plan quarterly. So the quarterly reports provide insight into all of the projects that are supported by ARPA 9817 funding. The narratives for each of these projects, the summary level information regarding total funding expended, and the updates to project timeframes and funding allotments are included in each of the reports. So as a grantee of these funds, your organization is likely rolls up to a particular project that the agency is responsible for implementing. And so those projects are what is described in the narratives and in the spending plans. As you can see on the right, that is the cover page for their Q3 2024 report. Each of these reports are available online. Next, please. So let's talk about grantee monitoring, what that means and what that means for you. Next, please. So grantees are your entities. They all are selected for review through a sampling process that KPMG participates in, and documentation is requested that correlates with the specific program that you're involved in and the nature of your expenses. And so grantee monitoring is a federally required activity that is prescribed by 2 CFR 200, also known as the Uniform Guidance. Every entity across the country, whether you are a state, local, territorial, or tribal government that receives federal funding, they're subject to the Code of Federal Regulations rules regarding the use of funds, management of funds, reporting of funds, etc. Monitoring is one of those activities that's involved whenever you are a recipient of federal funds. And so the areas that are assessed in this program's grantee monitoring include, the first one is the duplication of time, effort, or benefits. This is whenever a grantee has utilized other funding sources for a similar purpose, and whether the total funding received exceeded the expected program expenditures. And the second one is supplanting, the evaluation of whether or not the grant program's funding was being used to replace or supplement or supplant another federal funding source. So in this instance, supplanting is a bad thing. Supplanting is replacing the intended use of funds that was funded from another source. Records retention is an evaluation of whether an acceptable records retention policy was in place. And then scope of work is an evaluation of whether supporting documentation substantiated that expenditures were expended in alignment with approved scope of work per the grantee agreement and the work plan struck between yourselves and the Colorado HCPF agency. The last one is capital expenditure. So it's an evaluation of whether capital expenditures were purchased and used as intended. Next, please. And so here's some common findings that we wanted to make sure to share. The first one is that with our grantee monitoring performed so far, there was an absence of budgetary documentation prior to and after the inception of the grant program. So a organizational budget with a sufficient level of detail that described what your organization was doing, and then a subsequent budget after receiving grant funds that describes and has details depicting what happened after you had become part of the grant program and after you had been awarded funds. The second is about the lack of supporting documentation for existing or new staff that were supporting the grant program activities. The third is about limited information regarding other funding sources that were utilized for similar purposes. The fourth is limited process documentation regarding Medicaid reimbursement. And the fifth is the absence of record retention policies. So these 5 common findings are what were observed in grantee monitoring so far, as we had described earlier. And these are 5 areas that we had taken so that we can expand upon them in this training so that we can talk about like, okay, well, if these were findings, what do we need to do about them so that we can be compliant with the state's federally funded grant program, so that we don't run into any trouble with the management of these funds and the use of these funds. Next, please. So let's talk about the duplication of time, effort, or benefits. So here, this is it's a term of art aspect that's related to funds management. And Will, if you can progress to the next one, let's talk about what that entails. So duplication of time, effort, or benefits, it occurs when a grantee receives federal assistance from multiple funding sources for the same purpose or the similar purpose. And total assistance that they receive from those multiple grant sources for that purpose is more than what is needed in total. And so what we call total need is also known as, a term of art, unmet need. So when the total need for program expenditures is more than total funding received for the same purpose, the unmet need is the difference between these amounts. Grantees of a federal grant may only receive funding up to the amount of their unmet needs for eligible expenditures to prevent the risk of duplication of time, effort, or benefits. The amount of duplication is the amount received in excess of the total need for the same purpose. So we say time, effort, and benefits. Duplication of time comes in the form of whenever you have employees who work on, let's say, a particular service or activity, who may be spending some portion of their time performing activities related to the grant and some portion of their time elsewhere. And if you have several funding sources that pay for that employee's time, there may be a duplication of time and the benefits that employee receives if they are double booked and may receive compensation from across several grants. And in addition to that, duplication of effort is whenever there's a duplication of the work that is performed by a particular employee or by the organization that could have been performed or should have been performed in relation to another grant source. And then duplication benefits overall is represented whenever you have an organization that is able to receive funding assistance from multiple grants for the same purpose and does not return said funding. That becomes a risk of having what we call a DOB finding and can prove problematic for an organization. Will, next please. So let's get into a very specific example. We'll talk about the calculation of unmet needs so that we can start with square one, right? So let's say that there is a local HCPF provider that requests grant assistance to expand their services to cater to the challenges brought on by the COVID-19 pandemic. And they require the assistance to add employees who will provide home counseling services for those who have experienced mental health challenges that derive from the COVID-19's isolation. And so the business is requesting 3 months of assistance. And so with that context, when we move to the right, what we have here in step one is about assessing the need. So we know that this business needs assistance to add employees, and they're looking for 3 months of that assistance. What does that look like for this organization? This organization projected that their project funds that are needed per month was $10,000, and the potential total need was that amount per month multiplied by that time frame of 3 months to produce $30,000. So that was their assessment of need. And step two is about the determination of assistance. And in their grant application, this business is submitting a grant application to request funding from a funding source. And they are asked to report if they are receiving any other additional or similar assistance. This provider, this business, made the right move, and they reported that a local faith-based organization is also providing $1,000 a month for the next 3 months for the same purpose. And so that brings us to step three. What is the unmet need for this organization? So we know that in step one, they calculated a sum of unmet need to be a total of $30,000. And other assistance, like we had mentioned, they received $3,000, which is 1,000 times the number of months that faith-based organization is providing support. And the actual unmet need, the maximum award that this business, this applicant, should be receiving from the funding source would be $27,000. The 30,000 minus the 3,000. And so what needs to happen for this business, for this organization, is that they need to maintain documentation of the calculation and justification to confirm their amount of unmet need. So quickly recapping, this business had an unmet need. They calculated what that figure was, and that figure is in relation to some amount of money per month and a certain time frame, which is a total of 3 months. And over the course of their activities, they received assistance from a faith-based organization, and in their grant application, they reported that as they should, and that resulted in an actual unmet need amount of $27,000 that they were able to provide in their grant application. And let's say there's a step 5 here. Let's say a happy ending that they received that $27,000, and it does not have the risk of duplication of benefits because the $27,000 already accounts for the assistance that they receive from elsewhere for the same purpose. Next, please. And so common duplication situations that arise, especially as it relates to this program, is when a grantee utilizes this grant's funding for expenditures that are billable through Medicaid. So if a grantee is a licensed Medicaid provider, an explanation should be maintained by the organization to detail the process that was followed for determining whether a service provided was eligible for Medicaid reimbursement. When personnel are funded, another situation, or their time is applied through multiple funding sources at more than 100% of total salary or time, then that is the result. That is a resulting duplication of time or duplication of benefits, right? The benefits being 100% or more of the total salary, or in the time being 100% plus of their time. And so these situations were common in the monitoring of the grantees to date. And so these are the types of situations that we should keep an eye out for. Next, please. So let's do another series of examples here. So this scenario is outside of the context of HCBS, but certainly relevant to a grantee of any types of federal funding source. So a county uses a portion of their CRF funding towards assisting a local hospital with their payroll expenses. However, their payroll costs had already been paid by another source of funding that included private insurance and Medicare and Medicaid. And so the background that we should know here is that governments may use CRF to support public and private hospitals to the extent that the costs are necessary expenditures incurred due to the COVID-19 public health emergency, which was a requirement under the Coronavirus Relief Fund. However, the form such assistance could take might differ. And so in particular, financial assistance to private hospitals could take the form of a grant or a short-term loan. And in this instance, this county had failed to prevent the duplication of benefits because they did not verify if the cost had already been paid by another source of funding that included private insurance, Medicare and Medicaid, and the hospital billing of patients. And so this county, they are the grantor, just like HCPF is a grantor to you. And so if they received federal funding that could be used towards assisting members of the of a community, such as a local hospital and the healthcare infrastructure for a particular jurisdiction, they can do so, but only after they make that determination of the benefits that an organization may have received so that they can prevent the duplication of benefits. Next, please. And so with another example is that let's say there's a family that's suffered job loss due to the economic impact of the COVID pandemic, and they are seeking rental assistance under a CRF housing program for 3 months of arrears payments and 2 months of future/current rent. And this family received $5,000 in CRF funding. And also for this family, the family failed to report that they also received $5,000 from a local faith-based organization. So in this simple scenario, the result would be that the program, the government entity that administered $5,000 in CRF funding to this family, failed to assess their need and ask the applicant if they're receiving or expecting to receive any additional or similar assistance, and they did not calculate unmet needs. And so these are two examples of the responsibility of a grantor, right? The previous one was a county, and then this one is another government entity that was responsible for a housing program. And in both of these instances, the grantor failed to assess the need, failed to perform what was needed to prevent the risk of duplication of benefits. And so how do these examples all relate? they all result in either the duplication of time, effort, or benefits, and the beneficiary of these duplications are able to take advantage of funding that should not have been administered to them. And it is important as the entities responsible for receiving the funds and dutifully managing them in accordance with the requirements of the program. It's important for grantees, grantors, and other types of organizations who are involved in the distribution and administration of these funds to keep an eye out for duplication risks. Next, please. So the key takeaways for us here is that an organization may only receive funding up to the dollar value of their unmet needs, or the value of the expenditures that is not covered by other funding sources, if we want to think about it that way. If multiple funding sources are used, a calculation of unmet need should be maintained, the math that we were talking about earlier. Number two is that retaining documentation of all funding streams and their usage is important to demonstrate that duplication did not occur. And number three, grantees that are Medicaid providers should maintain a clearly documented process for determining whether a service is eligible to be billed through Medicaid. Next, please. And the action steps that we consider. So we've talked about this overview. We talked about what it means. We talked about its applicability to you as a grantee. So what are some of those things that you could do? So if your organization does receive multiple sources of funding, document an unmet needs calculation to ensure that you're not receiving funding in excess of the total program need. Ensure that the documentation is retained for all sources of funding, including the evidence of the dollar value of funding received and the specific activities and expenditures that are funded through each source. If you can demonstrate that there's degrees of separation between a funding source for a particular activity and a funding source for another activity, then that would support the position that you did not have a risk of duplications. And number three is that if it doesn't already exist, document the process that's followed by your organization for determining whether a service is eligible to be billed through Medicaid if you are a Medicaid provider. So with that, I believe that is the end of this section. Let's go to next. Well, thank you. What I'm going to do now is pass it over to Laura, who's going to cover supplementing and not supplanting.
Thanks, Jonah. We can go to the next slide, Will. So like Jonah said, we're going to cover the concept of supplementing, not supplanting. We'll talk mostly about supplanting since that's not allowable, and we'll break it down into pretty simple terms. But firstly, just want to give everyone the background of the legislation that it comes from. It's in the American Rescue Plan that supplanting is not allowable. The exact statement is that we must use federal funds attributable to the increased federal FMAP to supplement and not supplant existing state funds expended for Medicaid home and community-based services in effect as of April 1st, 2021. So in simpler terms than that, supplanting is something that happens when an entity uses grant funds for a planned expenditure to replace funds in an existing budget, or even simpler, when you used grant funds to pay for something that you were already doing or you'd already budgeted out to do. There are some things that you do to reduce risk here. First being maintaining supporting documentation for all of your expenditure types and for 100% of your expenditures under this grant program. And then also you should be confirming that your grant funding is used exclusively for the purposes outlined in the grantee agreement and work plan. We know that you set these up in the beginning with the HCPF project team, but it's a good idea to go back on a regular cadence and reevaluate everything that you're doing to make sure that you're still aligned and you haven't started funding any activities that are straying from that work plan. We've got some examples of documentation types here that we recommend that you do maintain for all of your expenditures, but we're going to go into detail on these on following slides. So they're here for your reference, but I won't go through all of them right now. We can go to the next slide, Will. We did want to talk in detail a little bit about personnel expenditures. There are some things here that make this unique, and it's a pretty big topic for a lot of the ARPA grant programs. So I wanted to break down a few different personnel types for you all. On the high level, for all personnel expenditures, documentation is essential to confirm that supplanting is not occurring and whether team members are in existing roles, if you newly hired them for this grant program, as well as if either existing or newly hired are in clinical roles, which has some differences as well. So firstly, for existing roles, you want your documentation to demonstrate that all of the activities performed align with the approved project scope and work plan, and that those activities differ from or expand upon the activities previously performed by a team member, and that were funded through a different source. So if your team member was in a role, you want to be sure that your documentation shows that they're now doing something different or in addition to what they used to do, and you're not just taking their old role and now funding it through this grant program. This documentation could look like a few different things. One thing we recommend that you maintain is a description of the responsibilities and tasks prior to and during the grant timeframe, such as a dated job description. If you don't have that for existing roles, say you had an employee who transitioned to a new role and you never formalized it with a new job description, we recommend that you do that even retroactively to jot down what their responsibilities were beforehand, afterwards, and date it so that you have it on record. It's just as you go along, it's going to be harder and harder to look back and maintain that. So we recommend that you do that as soon as possible if you don't already have that. And then also timesheets with hours linked to specific grant program codes to confirm the activities performed. If you already do this with your timesheets for hourly employees, make sure that there's a specific code that they're charging their hours to for grant program activities, and that you can pull that in a timesheet report so that you can sum that up and align it to expended funds. And then for new roles, the documentation is pretty similar, but you want that to demonstrate that responsibilities and tasks were created and filled in alignment with the grant program scope and work plan. Documentation, again, is pretty similar, but a dated job posting or role description. Emphasis on dated. We've seen a few that have come in where people are just pulling the description, but there's no date on it, and that's altogether not as helpful. So we just recommend that you double check that you've got a date on all of those job postings or descriptions. And then also timesheet and payroll documentation for the period of interest as well. For clinical roles, on top of what's listed above, you also want to demonstrate that expenditures submitted for reimbursement are not eligible for Medicaid reimbursement or are for services otherwise previously funded through another source. There's no singular way to do this. Some best practices are to document the process that you follow for each expenditure type and how your organization looks at those and make sure that they are funded through the correct source and are or are not Medicaid eligible for reimbursement. Having that process documentation on hand is definitely helpful. We've also seen people do it in an Excel format where they take a look at each expenditure type and list those out there. So if you have any questions on that, we'd be happy to take a look, or HCPF would. We recommend that you work with the HCPF project team if you have any questions about how best to do that. Go to the next slide. We also wanted to focus a bit on budget creation and expenditures. Maintaining good budgets is really important for proving that supplanting did not occur. So we recommend that you maintain organizational budgets and update them on a regular basis, especially from the time periods prior to and during the grant time program. It doesn't need to be the day before and the day after you get your grant funding, but if you do your budget on a quarterly basis, on a monthly basis, making sure that you have on record that time period right before and right after the grant program. HCPF has provided grantees with an organizational budget template, which you're free to use. However, it's just a sample. You don't need to utilize that exact template, but we just want you to refer to it for the components that should be in an organizational budget. We can go to the next slide. We're going to look at a few examples of acceptable budgets and then budgets that could use some improvement as well. This first one here is done in the HCPF template. So you can see that they've got their budget before the ARPA award, their budget after the ARPA award, broken down by month. There's line items for each income source and then each expenditure type as well. So those subcategories where you can really see what you're spending your money on. And then after the ARPA award, we can see that that was added to as an income source as well as an expenditure type with subcategories. As granular as you can get in these is really helpful for a reviewer who's trying to understand what you were spending your money on and what you are spending your money on now and how that's different. So for example, if you're running a training program, breaking down into the cost to develop the training, the cost of paying people to provide the trainings, any room fees, things of that nature, as granular as you can get is very helpful. And then also just wanted to note that this budget is acceptable with the assumption that the grantee is maintaining supporting documentation for all income sources and expenditures as well. This is clearly done in Excel or some other similar format. And so in addition to those hard-coded numbers that you're plugging in here, you want to have the backup for each of them as well. We can go to the next slide. This is a similar budget to the previous one. You can see they've got the pre and post ARPA award timeframes as well, with their income sources and expenditures broken out. However, just the difference is that this is done on a quarterly basis, which is also acceptable. You can lump them together that way if that's how you're already doing your budgeting. And again, would just need to maintain supporting documentation for all of the numbers that are coded into this budget. You can go to the next slide. This here is a budget that could use some improvement. They do have the pre-ARPA award and then the post-award, so we can see the difference in totals in their income and then their expenditures. However, there's no subcategories for either, so it's hard to understand where they're getting their money from and then what they're spending it on. So a reviewer really couldn't tell if you are now using grant funding for something that was already on your budget or maybe wasn't on your budget or overlaps with another income source. So for that reason, it could use some improvement to break those out. We can go to the next slide. This is another budget that could also use some improvement or just some additional explanation. This is just the post budget or the post ARPA award budget, but in it you can see that the income now exceeds the grantee's total expected expenditures or budgeted expenditures of $272,000. Whereas they've got total income of $290,000. So in this, we would say that they're going over their unmet need. It's not necessarily incorrect. There are situations where this would occur. Say you're planning to spend that additional funding, it's just not been budgeted in yet. If you've got funding sources that are going to different things that don't overlap but are included on your same organizational budget. But it does require some additional explanation. So if you've got a budget that looks like this, we recommend that you document on the side, whether it be in a memo or something like that, why that excess income is occurring. And then while doing so, if you're recognizing that you do truly have more income than your expected expenditures, working with the HCPF team and your project team about possible recoupment of funds if you've been budgeted too many funds for what you're actually going to use. You can go to the next slide. So just a few key takeaways for this topic area. So grant funding cannot be used to replace the current funding for a budget expenditure. That would be supplanting. But your grant funds can be used to supplement existing funding. So a simple example that we like to use for this is if a school received federal funding, a federal funding stream to purchase 20 laptops for a classroom, and they had that in place. And then another federal funding stream came along that they were eligible for. They couldn't use that federal funding stream to then purchase those 20 laptops and reallocate that first funding stream elsewhere. They couldn't do it and buy those 20 laptops and then go buy something else with them, with the original funding stream. They could either use that new funding stream to purchase something totally different, say monitors for the classroom or something else, or they could supplement and buy an additional 20 laptops so they then have 40 rather than 20. So you can't just replace and move that away and reallocate it, but you can put funding on top and increase the total amount that you're purchasing. We also recommend that you retain documentation such as organizational budgets from the periods prior to and during the grant timeframe to help demonstrate that supplanting did not occur. And then when grant funds are used for personnel expenditures, make sure that you're considering whether your roles are new or previously existing, and your documentation should be maintained to demonstrate that the activities and tasks funded through the grant are new and exclusively focused on grant-related activities. Go to the next slide. And lastly, just a few action steps to take if you're not already doing these things. So if not already existing within your grant program files, organizations should already retain an organizational budget from the period prior to the grant timeframe and during the grant timeframe. And again, you have that HCPF reference file to look at if you haven't already done so. And then ensure supporting documentation is retained for 100% of program activities and expenditures. We'll go into the next section, a whole list of documentation examples that we recommend that you maintain. So that'll be there for your reference as well. And then for personnel expenditures, ensure the documentation is retained that demonstrates the specific activities and tasks funded through the grant. Payroll files, time cards, and data job descriptions should all be maintained if you have them available. Go to the next slide. Next, I'm going to pass back to Jonah, who's going to talk a bit about record retention.
Perfect. I love record retention because it seems so easy, but it's really not. But it can be if we are able to walk through all of these steps and be able to understand why it's so important. Will, next, please. So for records retention, the federal requirements that apply to all federally sourced grant awards is referenced here. And so from the Uniform Guidance, Section 2, CFR 200-334, financial records, supporting documentation, statistical records, and all other non-federal entity records pertinent to a federal award must be retained for a period of 3 years from the date of submission of the final expenditure report. And so this is relevant to HCPF and it's relevant to you as grantees, because as a recipient of these funds, as a grantee, your responsibility for retaining documentation of your uses of funds, including all of what's listed here, as well as others that we'll cover here momentarily, is highly important so that in the future, let's say a federal regulator, an auditor comes by and has an audit that they need to perform of HCPF and their use of ARPA 9817 funding. The agency will very likely turn to your organization as a grantee to be able to demonstrate that the award funds that were given to you are able to be accounted for. And so here is an important thing for us to know. So this is the basic minimum requirement for retention of documentation for the ARPA 9817 funding and for your agreements with HCPF as a grantee. Your grant agreement indicates that records must be retained for a period of 5 years following the final expenditure report. So 5 years from whenever you conclude your programming. And it is important that we adhere to the standards that are established in contracting documents, such as your grant agreement. If it says 5 years, then that is the time period that you as a grantee must comply with. Next, please. So for records retention, some items that grantees should consider regarding supporting documentation, and there is sufficient information to support the grant program efforts, include things such as identifying the purpose of the funds to help you determine what documentation is necessary to provide the proof of compliance, and then keeping detailed records of all expenditures related to the funds. This includes receipts, payroll documentation, and other supporting documentation to support reimbursement and justify expenditures. The third is about documenting how the funds were used and how they benefited the HCPF Medicaid population. And so this might include providing narrative information, such as documenting activities performed by staff in relation to the grant program purpose. Next, please. So here are a couple of examples of payroll transactions and their underlying supporting documentation that should be considered for retention. The first includes eligibility and compliance documents that have the program's verification of your program's alignment to an allowable expenditure. There's things such as transaction record listings of total transaction amounts, such as a general ledger. Payroll documentation, including the individuals, the total amounts per individuals, their titles, pay periods, and hours worked. Time cards or timesheets detailing what grant awards were worked on, when the work was done, who worked on the award, and when the time was reported. The last couple include percentage of time spent on activities related to the program, signed attestation forms verifying time spent towards the program, job descriptions of individuals or the roles of the individuals related to the program, plus dates, just like Laura had mentioned. And lastly, a clear alignment between the transaction amounts that are reported in the general ledger to the amounts that are listed in payroll reports. So things should line up. If a particular employee were to receive $3,000 in a pay period, and there's supporting documentation such as timesheets, time cards, an explanation of the percentage that time they spent on the program activities, and an attestation form, as well as accompanying job description that's part of their HR file or something to that extent, all of these things should line up to indicate that this individual was intended to work on program activities, and here's the support to demonstrate how, why, when, and then how much. Next, please. For deliverable transactions, so this is relevant for our grantees who may have developed deliverables as a part of their grant agreement with HCPF. And so the documentation that would work here includes things such as an invoice, and then approvals from HCPF or the fiscal agent for payments related to your invoices, progress reporting to demonstrate the work performed during the corresponding period, as well as evidence of HCPF's approval of work products, deliverables, progress performed to date, etc., and the evidence of eligibility at the subrecipient level related to the respective grant where applicable. So in this example, documentation of work performed serving the HCPS community. And so one key distinction here is that we talked about approvals from HCPF in two different places. So the first one's about approvals in relation to HCPF for invoices, and the second one is about the evidence of HCPF approval of other things that are generated, likely in association with that invoice: work products, deliverables, progress performed to date. Next, please. Contractor payments are an important one as well. And so some of our grantees may have agreements with contractors to perform certain services or to procure certain goods. And so documentation that is helpful here would be the agreement that your organization may have with a contractor, program level documentation such as an interagency agreement if that applies, eligibility and compliance documentation to verify the program's alignment to an expenditure, as well as approved purchase orders where applicable, invoices from your contractors, approvals from the appropriate party for payments related to those invoices, so typically approval from within your organization, and then documentation of the work performed during the invoicing period, as well as any sort of deliverable and or work products that that contractor was supposed to produce for you. Next, please. So the key takeaways for record retention is that the documentation should be maintained for 100% of grant-related transactions. Audit readiness from a federal awards perspective is challenging because not only do you as a grantee have to be able to maintain documentation for 100% of your grant-related transactions, so does HCPF. And the distinction is that for HCPF, whenever they incur a transaction, that transaction might relate to you as a grantee. And so there's one level, right? Let's say an auditor selects a transaction where they administered your grant award to you, that initial payment. If that transaction is selected, then the underlying documentation for that transaction includes the activities and the uses of funds that your organization had during that time period. Otherwise, for the other takeaways here, documentation should also demonstrate how the grant funds were used and all of the activities that serve to benefit the HCPS community in Colorado. The third is that documentation should be clearly dated and demonstrate when activities and expenditures occurred. Next, please. So your action items, if you have any hesitation about any of the records that you may have retained to date, or any concern about any documentation not retained to date, the first recommendation here for action step is to review program documentation to ensure that 100% of activities and expenditures are supported by retained documentation. The second is to ensure that retained documentation is dated and demonstrates when and for what purpose all funding was expended. And we'll make sure to help with articulating how do you retain all of these things. So if it's 100% of expenditures, what if I have several expenditures and several activities I need to account for? No worries, we'll talk about that too. Next, please. And where we'll talk about it is in relation to documentation storage. So I'm going to pass it back over to Laura, who's going to talk about the connection between records retention and how to retain.
Thanks, Jonah. We can go to the next slide, Bill. So for documentation storage, this often gets lumped together with records retention, like Jonah said, but we like to break it out. It's important to know, how you're storing things so that a few years down the line, if someone comes asking for something, you're able to find it, or someone who wasn't working on the project team now is able to easily find it in the documentation that you've retained. So our first main recommendation is that you write these down, whatever your internal expectations for documentation storage are, and provide them to all team members who are working on the project. We know that they might evolve throughout the course of the project as it gets more complex or as your scope changes, so you can revisit those on a regular basis as well. Some other best practices are assigning team members or a singular team member to own the consolidation and retention of project documentation. It can get quite confusing if you've got multiple work streams going on, multiple people working on the project to know who's saving things. It's easy to skip over things. So having one person or a few people responsible for it is always a good idea. And then also storing documents in a shared location, such as a shared drive or Google Drive environment, whatever your organization prefers is generally okay. Developing a folder structure that's easy to navigate and clearly labeled. We prefer or recommend numeric labeling schemes. They work well to promote organization so that your folders don't get shuffled over time. And we'll show you an example of this on a following slide. And then Also, following a consistent file naming convention, same vein, just makes it easier to understand what is it within each folder and file. The file name should clearly indicate the content of the file. And then if you're doing multiple versions, just if you've got draft deliverables to a final deliverable, make sure that you're either numbering them, V1, V2, draft, final, or put a date on them so that you're able to maintain version control pretty easily. And then also determining a regular cadence to review the storage of project documentation, whether this be monthly, bi-monthly, something of that nature, going through your documents and making sure that you have everything that you need. Again, I think we mentioned this earlier, but the further that you go along into your project or beyond the time frame of the project, the harder it is to look back and remember what you did do or should document. And then setting up a regularly occurring call to recap the activities completed over the prior month or 2 months and ensure sufficient documentation is retained. Again, if you assign that team member could lead the call, go through with all of your work stream leads or various people working on this project or trainings or whatever you're using the grant funding for, to make sure that you've accurately recapped everything that you've done over that time period and are maintaining the documentation for it. We can go to the next slide. This is just an example of what an organized folder scheme could look like. So at the first high level, we're using a numeric 1 through 6. So this is a deliverable-based grant program. They've got 3 main deliverables, but they also have folders for the project management documentation, a folder for their meeting materials and meeting minutes. You can store both your internal, external meeting minutes in there. Make sure that you're keeping those on hand. And then a folder for each deliverables A through C, and then also their project closeout activities, which could look different based on what project it is, but just making sure that they're all in one consolidated place. A subfolder for one of the deliverables could look like our next example here. So you've got relevant communications if you're emailing internally or with the HCPF project team about the scope or things of that you want to maintain those emails, PDF them and put them in your files. Any progress reporting if you're doing internal weekly reports, external monthly reports to HCPF, things of that nature, keeping those consolidated as well. All of your different draft deliverable versions, your final deliverable version. And then also, and this one often gets overlooked, any major decision supporting documentation. So if you're making any major decisions, whether it be changes to your budget, changes to your scope, changes to your operations that required some thought, some sign off from internal executives, some sign off from HCPF, making sure that you consolidate all of that documentation in one place is always helpful. So we've got a folder for it, but it could be a mix of meeting minutes, it could be email communications, things like that, but just keeping them in your files as well. And then invoice documentation. So any financials as you invoice to HCPF or you have any subcontractors working under you to deliver to you, maintaining that invoice as well. And then this is just some examples of what those file names could look like. These are all have a alphanumeric at the beginning, and then they're clearly labeled as to what's within them. You can go to the next slide, Will. Then lastly, just a few key takeaways for things to be doing. A clear folder structure for all grant-related files is important to ensure documentation is organized and accessible. And then grant program files should be reviewed by a designated team member on a regular basis to ensure they're up to date. Next file, or next slide. And then lastly, just some action steps, things to do if you haven't already done these. So create a memo to document the folder structure that is currently or will be followed to store all grant program files. Make sure folders are clearly labeled, and grantees should consider using a numeric labeling scheme. This is especially important if you have new team members coming on, if you're transitioning roles, so that someone has something to take a look at and fully understand where all of their files should be stored. And then assigning a responsible team member, if you don't already have one, to determining a regular cadence for grant program files to be reviewed for completion. Go to the next slide. So this is all of our content for today. At this point, we'll move into the questions and additional items, but I'll pass back to Jonah for any last words before we do that.
Perfect. I want to say thank you very much for hanging on with us until the end and making sure to absorb all of this information regarding grants monitoring, compliance, and being ready for federal regulator scrutiny down the line. As a recipient of a federal award, it's important for your organization, as well as every organization in the country that gets these types of dollars, to make sure that you're ready. And readiness comes from our day-to-day activities for whether or not we're assessing the risk of potential duplication of time, effort, benefits, all the way down to, are we saving our files down in a manner that is easy for somebody in the future to be able to find them and share them with a federal regulator. All of these things not only important for your organization so that you can continue to maintain the health and well-being of the folks that you serve, but for your organization to continue in its services into the future and continue to be eligible for federal awards in the future too. The impact of being unable to maintain and perform these activities is that as a potential grantee in future programs, there may be a risk of awarding funds to you if there is a history of challenges of being audit ready and challenges of having been a proper steward of federal funds. However, as we know, the grantees here are ones who work very closely with HCPF and who understand and appreciate the importance of the work that is needed. And so with that, what I'll do is go over to our Q&A. Just as promised, we wanted to make time at the end with the 9 minutes that we have remaining to go through any questions that folks may have. I do have one from Emma, and Emma asked, how can we show that we are not duplicating time if we are not a Medicaid provider yet? And so I think this question is a two-parter. The first is about being a Medicaid provider. So you don't necessarily need to be a Medicaid provider in order to demonstrate that you're not duplicating time. Duplicating time is prevented and documented by any sort of formal official process that your organization has for documenting time in general. So if y'all use time cards or time sheets, any sort of time entry to indicate the uses of time of your employees for any particular task, responsibility, or involvement in an activity. If there is documentation, a process that exists now for your organization that it's able to distinguish the time that they spend on different things, that should be sufficient for being able to demonstrate that you're not duplicating time. We'll do a very quick example. So let's say you have an employee who's responsible 20 hours a week, half time, for activities related to your ARPA 9817 award. Their half of their job is intended to service whatever needs there are on that side of the house for that particular program, for that particular funding. And then the other half of their time, the other 20 hours, is dedicated towards activities that are otherwise funded. It doesn't really matter what those activities are as long as they're not for the same purpose. And so here, for that particular employee, if your organization has a timekeeping system, process, or other methods that's able to distinguish the amount of time that they spend on grant-related activities versus non-grant-related activities, and be able to show that there's no intermixing by being able to, for instance, provide an attestation of their use of time, then that should be sufficient for showing that you are not duplicating time. Instances where time duplication does show up is whenever somebody, it's usually an existing employee, is looped in to help out with grant activities. And when they're looped in, there may not be a clear distinction from the get-go how much time they're supposed to spend on grant-related activities. And next thing you know, maybe they spend 30 hours one week, 40 hours another week, 20 hours another week, and that line seems to change, and we're not able to demonstrate the amount of time they're spending on grant activities versus others because we don't have that factored into our timekeeping approach, tools, or methods. And that's when you start having trouble with not being able to show that you're duplicating time, when somebody has that intermix and inability to distinguish. And so as long as there's systems, tools, approaches that are in place for showing how much time somebody spends on the grant versus not, then you should be A-okay moving forward. Now, there are some challenges for folks because we know organizations are not all the same, right? Some of them have a timekeeping system, they use Workday or something, and they're able to keep track of things that way. Some organizations may still be using manually written timesheets, time cards. Whatever the case may be, as long as your organization from the get-go is able to distinguish the activities and time spent on grant program related work versus not, then you should be able to prevent any risk of duplicating time. Emma, let us know if that answers your question. Feel free to let us know if it doesn't, because we're happy to take another stab at it. And for other attendees, if there are other questions, please feel free to punch them to the Q&A. We've got 5 minutes until the end. We will stay on until either all questions are answered or Wayne tells us we can go.
Yeah, thanks, Jonah. So, if anybody has any additional questions, please feel free to, like Jonah said, pop them into the chat. If not, you can feel free to go ahead and head on out. So, yeah, we'll hang on for the next 5 minutes if anyone else wants to put anything in here for us to answer. All right, and thank y'all for attending.